For today's Tune In Tuesday episode, I traveled to one of my favorite places, to Canalside in Buffalo, New York, to meet with well-known and well-loved OBGYN physician Dr. Praba Jeyalingam. Listen in as we learn from Dr. J about her journey to where she has gotten and details about her new position. This was my 11-year-old son's debut role as the cameraman. We hope you enjoy it.
Today I am with Dr. Praba Jeyalingam. She's coming from the private practice world, now taking on a new position as a rock star surgeon. So tell us about where you're going next.
Thank you, Missy. So my next step in my career is a job with Catholic Health. I now have a position where I'll only be doing minimally invasive surgery, GYN surgery, mostly focusing on pelvic floor prolapse, fibroids, hysterectomies, ovarian cysts, pelvic pain, endometriosis, things like that, and all with a minimally invasive approach.
Very nice. So prior you were practicing obstetrics and gynecology in a local OBGYN practice, so will you still be doing the obstetrics side as well?
No, actually I won't be doing that, so my schedule will be a little bit different, thankfully. But I do know a wonderful obstetrician in the area, my former partner at the practice, Dr. Cloud, and she's actually joining a private practice, Buffalo OBGYN.
Oh, that's great. We actually just did a video with Dr. Cloud.
Oh, wow.
Yeah,
Nice.
so that's great. Why did you choose OBGYN though?
Well, I've had, I'd say, somewhat unique path. I always knew I wanted to go into medical school, and initially I really did, as a medical student, enjoy a lot of the different fields, and I started in family medicine, actually. And family medicine, you train with kids, adults, all chronic illnesses, acute illnesses. Part of our rotations were some very hands-on rotations, like surgery rotations, but also obstetrics and gynecology. And obstetrics was very hands-on. It also had continuity aspect of it, and I just really had this passion towards it. I think because of this hands-on field that also allowed, a lot of primary care as well. And in the middle of my family medicine residency, I jumped ship and got into an OBGYN program.
Nice. Yeah, that's great. Awesome. So going from private practice to a position in the hospital, that's a big change on multiple levels. The one level I thought would be interesting to talk to you about is, do you think that in that switch, did you use an attorney to review your employment agreement, and would you recommend that somebody do that?
Absolutely. I think we go through a lot of education. And what's left out of that education and training is this perspective that we're just really not trained to focus on or even have or develop. And having an experienced attorney that has like years of experience reviewing contracts and employment agreements really helps you understand their language and pick up on things that will protect you and your future, no matter where you're employed or what you're doing for work. And with any contract that I've signed, I've always had to be an assistant attorney. Most recently, Bridget Maloney helped me a tremendous amount. And even in terms of negotiating the contract, it's advice that, I personally never would have had during any training.
Yeah. So we actually did a video with Bridget, and it was great. She talked about how physicians they shouldn't even sign kind of like the pre-agreement, the there's things in there that they don't even realize are in there that, oh, you know, it's not binding, it's okay for me to sign it.
Right.
They just don't even know what they're signing. They get excited and sign something away.
Yeah, after several years of consecutive school,
Yeah.
I think most people are in a position where they're excited to be employed or make money and
For sure.
have a job.
Especially having a dream position like
Yes.
yourself.
Yes.
And
Absolutely.
it'd be tough not to just want to run and sign
Exactly.
an agreement. Absolutely. Do a lot of work with the residents often. I know that. I'm not sure about the med student level, but one question I thought of that I really wanted to talk to you about is, what is one piece of advice that you would give to residents and or med students?
Well, that's a very broad question.
Yeah.
I do work with residents. The hospital, you know, is a teaching institution, and I do feel that education or teaching is incredibly important. I was very blessed to have great teachers and support around me, and I feel like that's the appropriate thing to give back. For medical students and residents, I think the most important advice would be a sponge as much as you can.
Yep.
You know, get as much exposure as you can. Talk to as many mentors and physicians or surgeons, and really utilize what's a very unnaturally stressful time as an opportunity to soak in as much experience, whether it's your own personal versus other people's experiences as well, and that will really go a long way.
I think that's really well said. I think many people quickly realize the value of networking, you know, regardless of what industry. And I like how you said that. I think the sooner they can get in to start talking and networking with clinical professionals, it's going to put them ahead.
Yeah, I think they'll find most people have a very unique story. You know, it's not high school, college, you know, medical school, residency. It's usually, it could very well be that, but most of the time it's not that straightforward.
For sure.
And when you go through training, you really learn from watching other people and even just participating a lot. So being present is incredibly important, and just keeping your options open, really.
Yeah, absolutely. I think so many med students and residents, they go in thinking that they're going to take one route, and you hear all the time, like you said, everybody has a different story, and it just completely changes. You get in and something about that specialty you originally thought you were going to do, it's not really where your heart is.
Family medicine to minimally invasive robotic surgery.
Right.
I mean, but I'm doing what I love, and that's really the most important thing.
Doing what you love, but also very good at as well. Okay, big question. Who was Praba Jeyalingam in high school?
So, I had a lot of fun in high school. I was very outgoing.
Okay.
I think I am the youngest of four, and my siblings were all very good students. So I think I surprised some of my teachers.
Somebody's got to be different.
But I think they were also surprised that, you know, I made it through and was able to get into a decent college.
See, there's hope. There's hope.
But I would say the average high school experience.
That's great. So you would say that there's hope out there for those that maybe want to get a little buckled down later on?
Yes.
Great.
Definitely. There's
Perfect.
definitely hope.
Nice. Final, very big question. Where is your favorite place to eat in Buffalo?
So I really do enjoy a lot of the restaurants here. When I think about the tastiest food and consistently the best atmosphere, I'd have to say Bacchus. Their menu has a very good variety. It's all delicious.
Oh, that's great. Nice. Lots of really good places here, like you said.
Yes.
Oh my goodness, it's so difficult, even just from a dessert situation. You know.
Yes.
Yeah. So that's actually a really tough question.
It is. It is. I also think it's being like a block and a half away from my apartment might have a little bit to
There's some influence there. Yeah. You can
but
walk.
it is an overall wonderful experience, I think.
Very nice. Well, thank you so much for your time today.
Thank you.
Appreciate it.
I appreciate your time. Thanks.
Yep.